Good afternoon, everyone. Thank you so much for tuning in for this series on women's oral health. Today we're talking about beauty, and I just want to give my own disclaimer about beauty. Beauty is very personal for the individual as well as the audience. And with that, I want us to just understand our perception of beauty is influenced by culture, it's influenced by media, it's also influenced by experience. Every human being has their own beauty value. And with that, we're going to get into the specifics of oral beauty. And when I say oral beauty, I am talking about our smile, our teeth, the harmony of our face that really comes from all the parts of our facial anatomy that give people a perception of beauty. My quiz earlier this week was about where beauty begins, and it's not the teeth. Thank goodness, right? As a dentist, I'm like, whew, it's not all on me. It actually begins with our eyes. That's why eye contact is very important. Our eyes are very powerful. Where they're positioned on our head is important for us as well as our audience. Those are talking to us, listening to us, engaging with us. I have an 11-year-old and I tell him eye contact. It's really important. Now, with that being said, symmetry is also very important. And the way we're designed is brilliant, right? We have our anatomic left and our anatomic right, and we have pairs. So where we have two eyes, we have one nose, one mouth. And so that's why the eyes are so significant. Now, we're talking about women's oral health. So let's be really clear. Women are more heavily scrutinized for their beauty value than men. That's just the way it is. That's the rule. I didn't make it up. Let me tell you, 10 minutes ago, I did not have makeup on. I put on my pink, my fuchsia, because it is bright and it has cool undertones. It makes my teeth look brighter. I wanted to make sure I was on here live with the natural light because I want to try to manifest beauty in terms of my aesthetic and what you're seeing today. So we're going to talk about this, and there are two things when it comes to our smile. There is pathology. There are things that happen to our teeth, even in utero. You know, mothers that were taking antibiotics such as tetracycline, their children have dark teeth. We cannot change that shade. We have to cover the teeth with veneers or crowns. Also, drug use, whether that drug use is recreational or it's actually for healthcare. Drug use can influence our teeth. Trauma can influence our teeth. I mean, every little kid that falls off a bike, I'll tell the parents out there, let's hope it's 6 or 7. But if they chip their front tooth at 9, 10, that's an adult tooth. That may discolor. That tooth may need treatment. What if it comes all the way out? I mean, now you have to replace that tooth. And then there are things that, are within our control. And so when we look at our teeth and we think about the aesthetic value, we think about the shade, we think about the alignment, the position of those teeth, and we think about function, right? So another quiz question that I had was, what really contributes to smile youthfulness? And smile youthfulness is something that's really interesting because it's actually more dynamic than people think. First of all, I will agree that baby teeth, milk teeth, are brighter than adult teeth. They are, right? They're only there for a couple years. They're bright, they're fun, they're cute. Our children look like dolls and we love them. Their heads are still really big compared to their bodies. And their teeth are not scrutinized. As long as they're there, most parents are we're worried about feeding and eating and learning how to talk and other functions. Now, adult teeth come in. If they come in bright, great, that's wonderful, right? But they may not come in bright, and it has nothing to do with your pregnancy. It has nothing to do with what they eat. Teeth they're natural. They're fossils. They're rocks. They're what make us actual animals. Teeth are funky. They come in with little bumps on them. They're called mamelons in the front. And if your occlusion, your alignment is not proper, those little bumps don't go away. Now, that's another thing. Crowded teeth, crooked teeth are often associated with children. So that's a factor that's youthful. Right? It's youthful when we see children have that goofy smile in 2nd or 3rd grade. At the same time, if you have habits, things that you've done, you sucked your thumb, your fingers. I used to actually suck my 2 fingers. I sucked my fingers till I was 10 years old. My dad said he'd give me $100 if I quit, and I quit. And he never gave me that $100. But I stuck my fingers, and I had braces in high school. Digits, habits that we have, whether it's our thumb, that can put pressure on our palate. We may have an open bite. And when we see people with open bites, we think they look young, right? We're like, why is it almost looks like a child. It's a youthful smile. As that young person grows up into adolescence and post-adolescence, beauty is then assigned to them. And yes, their smile impacts that perception and that value of beauty. And then there are pathologies. There are genetic defects that, have oral manifestation. There's diseases, STDs, that have oral implications. There are so many things that happen to us that impact our smiles. And that's why you have to have empathy. When you see a person, are they smiling? Sometimes just a smile. It's not about the teeth. The fact that they're smiling is enough. And smiling is actually, it's neurological. Like it's in our brain. Something happens. It may be a memory. It may be a scent. Whenever I smell my mother's perfume on somebody, I smile. Or it could be like someone tickles you, or you see something that makes you happy. And then your brain tells your body to then smile. And I actually smile when I'm stressed, right? So anybody who knows me knows that the bigger my smile is actually means the more stressed I am. However, my smile puts people at ease. And I would say, if somebody asked me what has helped me as a dentist, as a clinician, it really is my ability to put patients at ease. Most patients are worried. Our dental experiences, again, can often be personal, but are associated with pain and discomfort. And so my smile, I use that as a tool. We have two sides. We have pathology, and then we have our personal, individual factors that go into our smile. As a rule, teeth are bright. We call them white, right? But they're like 45 different shades of teeth. Like when we pick teeth, whether it's for veneers, dentures, fillings, corrections, we actually have shade guides. We don't just say white. It's not like going to the paint shop. We actually have so many things that go into the brightness of the tooth color. And those factors are the actual chroma, the saturation of the tooth. So our teeth are translucent. So in the light, you might see that they look a little see-through. That's because they're translucent. The enamel is not opaque. It's translucent. And so that the brightness that you see is influenced by the tissues underneath the enamel. And those tissues are not white. Those tissues are yellow. They're cream. Sometimes they're gray. And that could be because of age. That could be because of trauma or just health, right? So when we choose a shade, we have the hue. We also have the saturation, like, we talked about how thick that enamel is. And then finally, we have value. The value is the brightness. So we have value, hue, and chroma. We have all these things that go into picking the color of your teeth. And then teeth are not monochromatic. My front tooth, if you look at it in 3 dimensions, it's not the same color in all of those dimensions. Other factors are, is it a front tooth? Is it a back tooth? Our anterior teeth are brighter than our posterior teeth, average. Our upper teeth are bigger and brighter than our lower teeth, average. Age is a big factor, how you want to look with your smile. And also when we think about the function of our smile, right? So all those factors go into picking the actual color of our teeth. Another thing is the eyes are significant because our teeth, in my opinion, as a cosmetic dentist, our teeth should not be brighter than our eyes. It's distracting for the audience. It's actually, it's disturbing. It's disconcerting. It concerns people when your teeth are too bright. But harmony is important. Also, skin tone. If you're melanated, then your teeth will look brighter. It's just natural. If you take a white sheet of paper and you put something next to it that's not white, one of those shades will be perceived brighter. So if you have melanated skin, your teeth look brighter. I hear this all the time. I read it in magazines, and I wonder, it's a little sensitive to talk about brightness with regards to race, but melanated people typically their teeth are perceived brighter just because of the contrast of the skin tone. So all of those factors are important. What we wear. So I'm wearing fuchsia, I'm wearing magenta. Again, I talk about the cool tones pull out the brightness of your smile. Whereas loud firecracker orange, that's going to make your teeth, yellow is going to make your teeth look a little, make them look as bright. But again, this perception. Red lips will always make your smile pop. Red lips will make malaligned teeth look nice. Red lips will make stained teeth look nice. Red lips, it's because it's psychological. Red lips make us feel good. Red lips are matched with femininity. The first lipsticks the rouge was red. And so that's what I'm talking about. It's your perception as well as the reality of your smile. Our lips, people are doing fillers in all parts of their face, but the fullness of our lips has, a couple functions. Number one, I always say, how you were designed is brilliant. Everything functions for a reason, right? Our lips are important to chew, to speak, and that's most important. So are your lips functional? Are they healthy? Number one, the shape, the thickness, the fullness of your lips, it does impact your smile, right? So my lips and my teeth, as well as my cheek, my jaw, everything was made to complement me as an individual. When I was younger, I thought my smile was too big. I thought I had a goofy smile. I'm heavily influenced by media. I thought my lips were bigger than the people on TV when I was younger, and now I'm older and people are getting their lips filled. It's like, all these things are going into what's perceived as beautiful, and those factors can change based on culture, experiences, and personal agenda. So that's number one. Number two, it's important to think about, now we can talk about a little bit of biology, how our lips, they don't have any oil glands, right? So our lips can get dry and chapped, and it's important to think about when you want to smile, when you want to have brightness, that you're not dehydrated and that the bacteria in your mouth are actually have healthy saliva. So that's a factor that impacts our ability to smile, because when your lips are chapped, you don't want to smile as much. Let's talk about shape of teeth. And actually, long teeth, there's two sides to long teeth. Number one, when our adult teeth come in, our front teeth should have a certain dimension to them. The length should be a certain proportion to the width. Our front teeth are very powerful. The alignment of our front teeth, the golden ratio. There's so many factors that actually make our smiles aesthetic based on the position and shape of our front teeth, okay? Now, that being said, if you have habits, if you bite your nails, if you grind your teeth, if you have excessive clenching, you are going to wear your front teeth, especially your front teeth, all of your teeth, but what we see, you're going to wear your teeth prematurely. Your teeth may start to look short. Shorter teeth are actually associated with older teeth. Now, when we see that in an older, and I'm going to be honest, an older gentleman, a 65-year-old man, 55-year-old man, it's not so much that it's not aesthetic. It's more that they have a habit and that stress needs to be reallocated outside of their teeth and their jaw. However, women, again, are scrutinized. So we're we want to improve your smile, right? So that's a habit that we want patients to think about, prematurely wearing their front teeth. At the same time, there's something that can make your teeth look long, and that is recession. So recession is often a function of gum disease. Our teeth will look longer because the gum actually recedes and more of the root surface is exposed. But recession can also be from trauma. It can be from toothbrush abrasion, brushing our teeth too hard. And so those are three things you should think about: habits, gum disease, and your actual oral hygiene regimen. Those are things that you can control. You should not use a hard toothbrush. Some people are like, why do they make it? They make it because of marketing. Hard, medium, soft, right? So hard is for your kitchen floor, medium's for your sneakers, and soft is for your teeth, okay? In the best case, your teeth are self-cleansing, especially our front teeth. The way they're designed, they get the most attention. They're smooth. They have a nice, round, smooth emergence from the gum line. They don't need that much work. You should just do a round, light, round, circular, just buffing, almost like you're just buffing, polishing those front teeth to make them a little shinier. Now, if you're clenching or grinding your teeth, then you can get these little lesions called abfraction. And abfraction is a little different than recession because it becomes like an indentation. It almost looks like someone carved out the butt of enamel that should be at the gum line. And that leads to sensitivity. So your teeth, you may notice symptoms of sensitivity to cold, to touch, and that's something you want to consider. So that being said, everybody wants white teeth, right? Teeth whitening is the #1 requested cosmetic procedure. It's like patients can have, never go to the dentist. They can have gum disease. They can have teeth that in our opinion, we think would be symptomatic of pain, and they will ask for teeth whitening. Teeth whitening is not new. It's been done for decades. Most commonly, hydrogen peroxide is used. Over the counter, those concentrations are going to be lower than what's in the office, and that's why in the office is your fastest way to the brightest potential of your teeth, right? And I say potential because that's your natural tooth, okay? Your natural tooth that's been subjected to coffee and steak sauce and who knows, trauma or medications. Now, there are cosmetic procedures to cover your front tooth, and that would include veneers. And what is a veneer? It's just a facing, right? It's like a window treatment. It goes on the front of your tooth, and it can correct stains, it can correct malalignment, it can correct chips, right? So you fall off your bike and you chip your tooth, and sometimes if it's small enough, we can just bond a filling. We can bond it and it's not really noticeable, and it kind of gets you along your way. However, if the fracture or the defect is too large, then we want to cover more of the tooth. And that's why veneer may be a better option, or even a crown, depending on how much tooth structure was lost and what else was affected by the trauma. So if you crack your tooth and the nerve is involved, then you're going to need a root canal, right? And this happens to several athletes, elbowed into the tooth during a game, and it starts to hurt, and next thing you know, you have an abscess or a pimple on your gum. That means the tooth is infected, and it moved inside the socket, and the nutrient supply was interrupted, and now it needs some treatment. If you don't get that treatment, the infection could spread and you could lose your tooth and you will lose bone. Let's talk about orthodontics. The alignment of the teeth can bring harmony, right? So crowding can be natural, but it increases as we age because our bones resorb. And so our teeth technically don't change. They stay the same, but our bones resorb. And so teeth that are already crowded, they will crowd more. And that can lead to more retention of plaque that hardens into tartar and also advances gum disease and can lead to early tooth loss. As dental providers, we're thinking more about the health of your gums, more so than the, aesthetic value of your teeth. But yes, generally straight teeth are healthier teeth. So there's a rule. I won't argue with the orthodontist on that. And so there are ways to align your teeth, whether it's with wires and brackets, retainers, aligners. Clear aligners are strong and very effective. And then retention. So the biggest complication of ortho is relapse. And I had braces and my retainers don't fit. Every time my mom sees me, she's like, I spent all that money on braces. So it's important to think about, again, your own personal agenda. Orthognathic surgery is brilliant. That actually is a part of our smile. So the aesthetic value is based on the shape, color of our teeth, but also the position of our teeth and the alignment of our jaw. So our teeth are one thing, but we have to remember they're inside of our jaws, and we have two. Our lower jaw, our mandible, is the one that moves. We can sit it on the shelf. It's the only movable bone in the body. And then our maxilla, our upper jaw, is attached to our skull, right? So that means that the way our teeth come together, our bite can be impacted by our skeleton. And that's very pronounced. So orthodontics, oral surgery, it involves so many complex procedures to reposition the jaw, whether you're moving the lower jaw back, maybe putting pressure or techniques to expand the maxilla, the palate, and then aligning the teeth. And so this is done over several surgeries, years, and it's a very dynamic interplay between the orthodontist and the oral surgeon, and of course the patient. This was really interesting for women's oral beauty. I did my externship in New York at New York Presbyterian Hospital at Cornell University, and I got to scrub into a orthodontic surgery. And the patient had a twin sister, and so they both had class 3 malocclusions. Their lower jaw was more forward than the ideal alignment. And class 3 occlusion, it commonly looks like a mean smile, and it's very masculine. When you see it on women, heavily scrutinized for that. And it was interesting because the residents were talking about the fact that they both girls wanted that surgery, the twin sisters. They wanted it so bad, and they got it together. And I thought, wow, that's really interesting. And it was great that their family was able to provide that for them and their development at the right time. And there are a lot of factors that go into when those type of surgeries are done, how many surgeries are done. And again, that's a different topic, but you definitely want to talk to your dentist and have the specialist evaluate your smile so that you can position your teeth for health and function. And that's another thing, function. Our teeth are functioning so that we can chew and process food and speak and communicate. And yes, I think our teeth are positioned for mating purposes as well. Like our smile, our eyes, everything allows us to communicate as human beings and procreate. So teeth whitening over the counter, there's so many things. I mean, there's whitening toothpaste, there's whitening trays, some are light activated, they're dissolving strips, the whitening pens. And these are all fun. These things you can do on your own. I think it's great. The industry's wide open for everything that you really need. Again, anything over the counter is just going to be a lower concentration, so it's safe for you to administer on yourself. Anything that's more powerful needs to be done under the supervision of a dentist, a dental team, and so you want to ask your dentist about that. I mean, just for reference, your average teeth whitening treatment is going to have 30%, sometimes 40% of hydrogen peroxide, and then anything over the counter, I think Crest white strips like Lux, it's maybe 8-10%. It can only be so strong. Whitening toothpaste is probably 1, maybe 5%, but it's very low as well. You can actually, hydrogen peroxide is nothing new. It's been used in medicine and oral health for hundreds of years. Like, it's an antiseptic, and so hydrogen peroxide, it actually will brighten your teeth, and it also helps your gums. Hydrogen peroxide can be used as a mouth rinse. You should dilute it over the counter. It's 3%. Dilute it 50-50 with water, and that can be used to rinse the bacteria and also illuminate your smile. One thing about hydrogen peroxide is, of course, sensitivity, and that's just because of the free radicals. It's a chemical reaction. When we apply the agent to lift the stains, as it breaks apart the stains, the free radicals are released from the formula, and that can cause sensitivity. But there are a lot of things that we do to minimize sensitivity. We use salts, we use fluorides, and we can do a lot to minimize your experience. That's why if you're really concerned about sensitivity, you want to do procedures in the office. So we talked about smile value, which I think is important because value for us is brightness. Okay? Value for you is personal. Now, agenda, personal agenda. I say this because there are 3 things. Number 1, you're your own person in society. If you are in an aesthetic field, media, you're on TV all the time, you may have people scrutinizing your smile, right? If you interact with people one-on-one, then your frequency for teeth whitening and even investing in cosmetics the need may be higher than someone who isn't public facing and doesn't maybe wants to look nice in a few family events. But so frequency and really the levels of investment in your smile, it is personal. So the other thing is things that you can do. I talked about colors, right? What we wear, our hair. So our teeth are, generally they're rectangular, right, in the front. However, curly hair versus straight hair. So you need to look at the shape of your head, your jaw. If you have a heart-shaped smile, then you want to think about the shape of your teeth. If it should typically harmonious, naturally harmonious. Everyone's teeth are shaped a little differently. Everyone's lips are a little different. Rihanna has this, I mean, she's like a doll because she's so uniquely, authentically beautiful for so many reasons. And very, very importantly, her character, right? We've gotten to know her over all these years, but we feel connected to her. And then on top of that, the icing on the cake is that she's aesthetically pleasing. She's easy to look at. One thing that it probably is associated with social media. Traditionally, back in the day, with Hollywood, the more symmetry an actor had, the easier it is for us to watch them in a movie for 2 hours. And the example I learned in dental school was Denzel Washington. He has great symmetry, right? Even though I think he's had his teeth done, he's had some dental work, he still has a lot of symmetry. And again, our skeleton can resorb our bones. Everything impacts, where things end up shifting as we age. But Denzel would be a good example of great symmetry. Now, someone that didn't have dental symmetry, who has had a great career, is Tom Cruise. If you look at his movies from the 80s, and then, look today, you can, it's almost like two different smiles, right? He's had surgery. I think his midline was off by 7 millimeters, which in dental world that's like severe. His teeth weren't straight, et cetera, et cetera. All right. One other thing about cosmetic dentistry is gums, right? So we've all heard the term gummy smile. And again, smiles are personal. We look at the smile and want to enhance it for your personal satisfaction, so long as it's healthy. But sometimes our jaw may not allow our lips to cover our teeth as much as we want. And then sometimes our teeth don't erupt all the way. And that's another aspect of length of teeth. So there's something called altered passive eruption. And it means our teeth, there's just about 10% of our teeth still hiding under the gum line. And that can be corrected sometimes with orthodontics. And sometimes there are surgeries that can be done to lift the gums. And it sounds a little scary, but it's very common, and it really leads to great aesthetic results. And so if you do want to get, the best result, you want to consider all the factors, the position of the gums, the alignment of the teeth, and the brightness of your smile. So hopefully you guys got some insight on oral beauty. Bye.